Hello everyone, welcome back to CGMeds. Today we are diving into an exciting new series all about pregnancy. In this first video, we are going to walk through what to expect during those crucial early weeks of pregnancy known as the first trimester. Whether you are a mom-to-be or a supportive partner, this video is packed with valuable information. So let's get started. What is the first trimester of pregnancy? Pregnancy has 3 trimesters or stages. Each trimester is about 12 weeks or 3 months long. A full-term pregnancy lasts 40 weeks or between 9 and 10 months. Your doctor will talk to you about fetal development in terms of weeks. Your first trimester lasts until the 12th week of pregnancy. It may seem strange, but your pregnancy actually begins on the first day of your last menstrual period. This is called the gestational age of the pregnancy. Let me explain this to you in simple words. You know that one menstrual cycle lasts for 28 days or 4 weeks, and menstruation, that is your period, occurs on the 28th day of that cycle. So if you are pregnant and you miss your period, then the first day of that cycle is considered as the first day of your pregnancy. So this means by the time you know you are pregnant, you are already on the 28th day or 4th week of your pregnancy. This can be very confusing. Your doctor calculates your delivery date by adding 40 weeks to the first day of your last menstrual period. Understanding weeks of pregnancy. The first 2 weeks of pregnancy are part of your normal menstrual cycle. The first week is your period and the second week is ovulation. Once you ovulate, your egg travels through your fallopian tube to your uterus. If it meets up with sperm, they combine and fertilization occurs. During the third week of pregnancy, the fertilized egg travels to your uterus. On its way down to your uterus, it divides into more cells. Once it reaches your uterus, it implants into your uterine lining. This triggers your body to recognize that you are pregnant, and a series of changes begin to happen. Most people miss their period and they get a positive pregnancy test. Now let's see the answers to some of the common questions all mothers face during pregnancy. What can I expect in my first trimester? Your first trimester or pregnancy is full of many physical and emotional changes. It can be very overwhelming time and your mind may be racing with questions. Plus your hormones are in overdrive. In fact, your body produces more estrogen during one pregnancy than it does during your entire life while you are not pregnant. This surge in hormones can cause some unpleasant pregnancy symptoms. You may find yourself feeling moody, bloated, and tired. While you may not see a prominent baby bump yet, but your uterus is expanding and your blood volume is increasing. It is okay to feel both excited and nervous. Talking to your friends, partner, or a doctor may help you feel better as you navigate your pregnancy journey. What should I do in my first trimester? Your first trimester is very important. You might not look or feel pregnant, but lots of changes are happening. If you don't have a doctor or a pregnancy care provider, you should find one as soon as possible. Getting early pregnancy care can help you to avoid any potential complications. Make a list of questions or concerns you have so you are ready for your first appointment. Now is a great time to think about your overall health and what lifestyle changes you may need to make now that you are pregnant. What are the most common symptoms during the first trimester? Every person and every pregnancy is unique. An increase in hormones causes most of the pregnancy symptoms. Some of the most common symptoms are sore breasts, nausea, mood swings, feeling tired, needing to pee, acne or other skin changes, and mild shortness of breath. Your heart is pumping more blood during pregnancy. This means Your pulse may be quicker and you find yourself losing energy more easily. Be mindful of how much demand pregnancy puts on your body and take rest when you feel tired or out of breath. Which test will I have in the first trimester of pregnancy? Prenatal care appointments are important because your doctor discusses what you can expect during pregnancy and delivery. He performs checkups and screenings and answers any question you have. Your first prenatal visit. You will have between 2 and 3 prenatal visits during your first trimester. This can vary depending on your doctor or if you are high risk pregnancy. You can expect to discuss your personal medical history, gynecological and obstetrical history like prior pregnancy and deliveries, as well as any family medical history that may affect your pregnancy. This visit is very thorough and to make sure that you and the growing fetus are healthy. At your first prenatal visit, your doctor will calculate your due date. You can also expect them to perform the following: a physical exam including checking your weight and blood pressure, a pelvic exam, test to check for certain sexually transmitted infections, check your pee for bacteria, protein and glucose, other blood tests to check hormone levels, Rh factor, iron levels and certain diseases. And doctor will also check the fetal heart rate. Some doctors use transvaginal ultrasound at your first appointment to confirm the pregnancy and measure the fetal heart rate and size. This ultrasound also shows if you are expecting twins or triplets. Most pregnant people are offered at least one ultrasound in their first trimester. If you are expecting multiples, you may be offered additional ultrasound. Your doctor may suggest other screening tests during pregnancy. Screening tests identify if you or the fetus are at risk for certain health conditions. Based on the result of your screening, you may need diagnostic test. So talk to your doctor about the screening they recommend. What should I not do in the first trimester of pregnancy? Once you find out you are pregnant, it is normal to have to make some lifestyle changes. These changes help to ensure that everyone is healthy. You should avoid the following things during your first trimester of pregnancy: alcohol, cigarettes and tobacco, recreational drugs like opioids, contact sports like football or activities that put pressure on your abdomen, foods like raw fish, uncooked meat and unpasteurized milk, cheese or juice. You should also avoid hot tubs and saunas. How should I take care of myself in the first trimester of pregnancy? Stay active as much as you can. Listen to your body and stop for rest if you feel any discomfort while exercising. You may need to modify your exercise routine during pregnancy. Take a prenatal vitamin containing folic acid. Eat a variety of healthy foods including fruits, vegetables, meat, eggs and whole grains. Get plenty of rest. Drink plenty of water. Attend all of your prenatal appointments. Thank you for joining me today. If you found this video helpful, don't forget to hit that like button and subscribe for more tips and insights. Wishing you a joy-filled and healthy pregnancy journey. See you in the next video.